We're live. Hey everyone, thank you for joining us and welcome to Urban Renal Talk with Tamika.
And Steve, hello everyone. How's everyone doing tonight?
We hope everyone is well. We'd like to
Tamika?
say real quick, rest in peace to Aretha Franklin. She passed away today. I personally liked Aretha Franklin, so I was kind of upset. But everyone has a expiration date, so no one's here forever.
Yeah, absolutely. I saw it all on Facebook, and I wish her condolence to the family. Yeah, like you said, everyone, even me and even you, have an expiration date, and it's what you do between the time you're born and that
Yeah.
ending date is what you do with your life.
Mm-hmm. Aretha Franklin had a quote. It said, "Every day is a gift." And I believe every day is a gift because no matter what you go through, as long as you're upright, you can make some type of change. You can find some type of happiness versus dwelling on your situation. A lot of people get stuck in where they're at versus where they can be
Absolutely.
and let that situation take them nowhere versus trying to find that light, because no matter what you're going through, even in death there is a silver lining.
Absolutely. I agree with you 100%, Tamika.
Yeah. So today we're going to talk about a couple topics. It was supposed to be I Need a Transplant Thursday, and I have yet to get some people to sign on, so it's okay. I'll try it again uh, in a couple weeks to see if someone or 20 people wants to come on and tell their story in 5 minutes and ask for a kidney from anyone. You never know. The word of mouth is very positive and amazing. So,
Absolutely, I agree with you, and I second that with Tamika. If anyone is out there that wants 5 minutes to share their story and also look for a donor, we definitely want you to come on.
yes, the reason why this came up is because I've been on social media watching how many people have gotten kidneys just from word of mouth, just from the power of asking. And a lot of times we don't ask because we fear rejection, not realizing that no is not the final answer. Like no is next opportunity. So if someone says no, you just move on. You don't dwell in that moment because your uncle or your aunt couldn't give you a kidney or your mom she couldn't give you a kidney. Don't get mad or get upset. Just go to another option. So,
Absolutely, absolutely.
it was like a dad got a kidney. His name is Kidney Dad. He got a kidney from off of Instagram, and some people got kidneys off of Facebook. And I'm like, well, hold up. If these people are getting kidneys, let me just open up more opportunity for other people that may not know what to say or how to say it. And bring awareness to their condition, and maybe somebody will feel generous and be like, hey, let me help this person out.
Absolutely, and that was another reason for the Sunday morning transplant coffee talk is to give a platform, especially for those who are in the transplant process. And Tamika, just yesterday I was at a clinic where someone that I know that had a transplant, and after 15 years, it rejected because
Hmm.
they're back on dialysis. They think it may have came from kidney stones. They had some kidney stones and the treatment for the kidney stones, and they think that kind of knocked the kidneys out.
Wow. Did they ask the
Unfortunate.
doctor?
Huh?
They asked the doctor?
She didn't get in depth with me about it, and I didn't
Mhm.
pry, but that was uh, what the person had told me that
Oh,
they think
wow.
it was due to the kidney stone.
Okay. Wow. I'm so
Yeah.
sorry to hear that.
So and see, that's I'm sure that that's something to be talked about because after 15 years of being free from dialysis, and then your kidneys reject, and you have to restart that whole process again. Uh,
Mhm.
I'm sure it's not an easy process to take.
No, I doubt that it is. I think with anything, even being in jail and coming out, you have to get reacclimated to that environment, and when you have a transplant and you come back, I've heard patients say feeling embarrassed.
Right. And
Embarrassed.
there's no need to be.
There isn't, but it's easier to see it than done. I wish we did have someone to talk to about how they felt, because I'm only going on what patients, have said to me in the past. But a person really living that life is a whole different conversation.
Oh, absolutely, absolutely.
You know.
So,
So we're gonna go
oh,
ahead.
go ahead.
Okay. So tell them about Sunday morning coffee talk, just so everyone knows what Sunday morning coffee talk is about.
Okay, so Sunday morning transplant coffee talk. The concept behind that show is to give individuals who are going through the transplant process, and what I define the transplant process to be, and this is just my for me, is someone who is officially active on the transplant list, registered with a transplant center, someone who has received a transplant and that's living right now successfully with that organ, or someone, as I mentioned, the person yesterday that I ran into at the clinic, someone who been on who had a transplant, but the transplant rejected, and so they had to restart dialysis. And this show gives individuals in that process a platform to share, their story just pertaining to the transplant, because there's other people who are watching right now who may want to get on the transplant list and may have some hesitation or just some questions, or even what you mentioned a couple of weeks ago about the myths of
Mhm.
transplant. So I'm hoping that this show will kind of dispel that. The myths also give um, um, evidence-based facts and information on organ donation, and also to talk about how there's more people waiting for a kidney transplant than there are organs available, and what could be done to hopefully keep the people who are on the transplant list, keep them motivated and keep their spirits up to wait for that call.
Right, Steve. Did you know that um, the kidney is the most needed organ out there? Like the one that's the top on the waiting list.
Really,
Yes,
I,
over a
I,
heart, a lung.
I
Yes.
wouldn't be surprised, to make, especially with 31 million people with kidney disease, also with kidney disease being the ninth leading cause of death,
Mhm.
more than breast cancer and more than AIDS. But um, those two diseases get more airplay and get more advertised than disease does, and it's that ninth leading cause of death.
Yep, it really is, and a lot of people don't understand it. When we was vending this weekend, a lot of people thought just drinking water was going to save their kidneys. Like, there's so many myths about saving your kidneys. The parents were so uneducated that they said, well, I'm drinking more water. Well, it's just not the water. You, of course, you have to flush your filter, because that's what your kidney is a filter. But you have to do more than that. We have a question down. No, we have a statement down here by Pat. I'm gonna put it up there. Can you see it, Steve?
Yes.
Okay. Pat said she made the transplant list at UNC, but there's not much help for them. Wow. She's looking to go somewhere else. Yes, Pat, you can go somewhere else. You can go. I think it's 2 hours out to find a transplant.
And
So
a lot of hospitals in North Carolina. It's just finding which ones are transplant hospitals, for kidney
right,
transplant.
right.
But
But she have to be in the like she have to be so many hours away or something like that to be able to go get the kidney.
I wonder if Pat, if you can specify when you say that there's not much help from them, because normally when someone goes on the, pretty much goes on the list, they're supposed to be collecting your blood each month at your facility and sending it to the transplant coordinator, and hopefully, a match will come in. So the transplant centers, I never heard of them really doing too much other than maybe keeping in contact with the person who may be really, up on their care and really following through. What about you, Tamika, up in Philly or the facilities where you worked at when it comes to transplant?
There's a lot of transplant centers. We have like Temple, Jefferson. Most of the hospitals here are transplant hospitals. So in
Are
Philadelphia,
they pushing transplant?
yes, they do come out to the centers, especially Temple. Temple transplant team does come out and talk about transplants. But a lot of people are fearful because of the myths that they believe in transplants.
What are some of those myths?
Uh,
I didn't mean
some
to
of
put you on
those,
the spot.
what'd you say?
I said I didn't mean to put you on the spot.
Oh, no, no, no. That's fine. That's fine. I was just reading her comment. I was going to post it. So, some of those myths is that, for one, that person is not taking account for, like, so say, like, if a patient is over 75 years old, they can't get a transplant. That's not true. They can get a transplant. They believe that if they're HIV positive, they can't get a transplant. That's not true. You can get a transplant. Some patients are scared because they've seen other patients transplants not working, so they don't want to go through what that patient went through, not knowing what type of kidney that patient got.
Right.
Um,
Everybody's different when it comes to that.
yes, and then they also believe that once they get a transplant, they'll never have to touch the kidney machine dialysis again. That's not 100% true. Things happen.
Right. And
Kidney
so,
transplant is a cure. I'm sorry, kidney transplant is a treatment, not a cure.
just about to say that. You beat me to the.
Right.
Yeah, absolutely. I agree with you 100% on those myths. And,
Hmm.
you know, and on the other side of that, Tamika, kidney transplant is not for everyone. Uh,
No.
some people may not be medically qualified to be on the list. You got
Hmm.
some people who have different opinions about receiving another organ from someone. As a matter of
Hmm.
fact, God rest his soul, my buddy Earl Winston Carter Jr., who recently transitioned, he was a Jehovah Witness, so he didn't take blood transplant, and he was a kidney patient, so his hematocrit would get down extremely low, and he wouldn't get the transfusion. He would get plasma expanders or normal
Hmm.
saline. And matter of fact, I'm not sure what hospital in Philadelphia, but there's one that Jehovah Witness go to that give you blood expander if you have surgery and you don't you're against your religion to receive blood. They have other methods that they can use to accommodate surgery.
Oh wow, I didn't know that. I have to. look into that. I have a couple of Jehovah's Witness patients.
Mm-hmm.
So Pat put down here that there's no support from the hospital, but they sent her a box. I'm getting all the info online. Oh wow.
Yeah. See that box, Pat, that box that they send you uh normally has a tube in it, and it's supposed to go to the facility where you get your treatment. They supposed to draw the blood, and then technically they supposed to send it back. Some places give it to you and you send it back, but it's supposed to get back to the transplant coordinator so they can check your PSA antigen. And
Right. But Steve, shouldn't she receive the phone call about this box coming in the red tube that's in it?
yeah, absolutely. Maybe all that should have probably been explained to her at the beginning when she went in for her workup, even before she made the list. All that should have been explained to her. Now, I don't know. I never been to a transplant evaluation conference, or and never
Hmm.
involved in one. So I'm not sure what information is being told to the person.
Well, guess what, Steve? We're gonna have to start going to these transplant information sessions.
Yeah, but I mean the ones between the patient and the coordinator.
Hmm. Yeah, we're gonna have to start going to them. We
But
could go.
you know who would know that answer? Joe Bueno,
Joe Brando.
the
Okay.
trans. I call him the transplant coach now. You know the guy at South Carolina.
Yeah. So she said on here that they didn't tell her, but they sent her a letter in a box. So I don't
Oh,
know. A lot of times they forget. People don't read, and I'm not saying Pat, you didn't read it, but it's better to inform people and then send a letter. So let them know what they'll be receiving, and then send a letter. So you understand a little better, and you can ask questions. Through a letter, you can't ask a question. You have to call them, but if you're already on the phone with them, it just makes things so much easier.
absolutely. I agree. I agree. So let's talk about the back to school community health event that took place at Sweet Prospect Baptist Church in East Baltimore on
Okay.
August the 11th.
Okay, so
That was a hot day. It looked like it was going to be rain in the clouds, but that sun still out.
it was a very, very, very hot day. Basically,
Ab-
I guess we would call this the takeaway,
Sure, absolutely.
the takeaway from Baltimore. What I took away from our Baltimore vending experience, we were surrounded by two inner city projects and a church on a corner. What I observed was the lack of stores.
But I got to step away. Keep going.
Okay, go ahead. What I noticed was there's a lack of stores, there's a lack of supermarkets, there's lack of fresh produce. I've seen so many children had no knowledge of what their kidneys were, where their kidneys are, or what they do. And I just felt like it was so sad because these parents aren't educating their children enough to tell them about the parts of their bodies and what your body do. I remember as a child, my mom would be like, the eyes is to see and stuff like that. But these parents don't even have the knowledge to know that their kidneys filter their blood. All they know about is their heart. That's it. And probably their lungs. Don't smoke. But they don't realize how important it is to eat healthy and maintain healthy kidney function too, because once your kidneys go, there's always going to be something else that's going to go along with it, because believe it or not, your kidneys is like your central system, your central filtration system. And
Absolutely.
they weren't aware of that. The situation where they lived in like a deplorable, it just was it just was really sad. Like it just really was weighing on my mind once I got back to Philadelphia.
Yeah,
I
well,
still haven't good.
no, go ahead.
I said I still haven't shook it looking at those children, talking to them, having them take the pledge. It was still so upsetting because they're so poor. They're so poor.
Right, and this is the thing that people don't understand that I'm trying to hit home with. When you live in an area considered a food desert or a community that's at or below the federal poverty level, you're not thinking about health. Meaning, you're not thinking about your kidneys, you're not thinking about high blood pressure, you're not thinking about diabetes, you're thinking about surviving, you're thinking about getting from day to day or whatever that's going on in your life is consuming you, and you don't have time to think about kidney disease, diabetes, high blood pressure, heart disease, none of that. So, of course, if you're exposed to all this junk food and you don't have enough to get what you need to be healthy, and all you have around you is foods like McDonald's, Burger King, the corner stores, um, convenience stores, just Family Dollars, what Walgreens,
The liquor stores. I seen
liquor
that there
stores.
was a lot of liquor stores around there, but there was no supermarkets.
Yeah, absolutely. When you're consumed with all this, then you're not going to think about eating healthy.
No.
And this is what we observed uh, at this health event. And fortunately, we had a lot of people to come by the table, and unfortunately, the majority just wanted the giveaways and not
Mhm.
really wanted to hear the information they needed to hear to try to live a better lifestyle or just to prevent them from being at a high risk for hypertension or diabetes. So we did have a small amount of individuals that did consume that information and was really seeking knowledge to
Right.
to better themselves to prevent this. So I guess my takeaway from that event was a lot of uneducation, especially dealing with health, not enough awareness, uh,
Mhm.
or education need to be disseminated in the community and around. And Tamika, this where you was at, okay,
Mhm.
where you was at, that's the community that the area code or the zip code 21202. There's 17 dialysis clinics within a 2.5 mile radius of that church where we had the health fair, or you can say 15 to 20 minutes of each other from
Wow.
from that area. So that's how important that this information is. The tour, we kicked off the tour officially that morning. Um, and if it's happening here in Baltimore, we know and see that it's happening in urban areas just like Baltimore across the United States.
Mhm. Not just across the United States, Steve. This right here is like global. This is
Absolutely,
this is
absolutely,
this is like a global silent war going on. And if someone don't lift those covers up off of what's going on, there's going to be a younger generation where it's instead of it being 1 in 7 with kidney disease, it'll be 1 in 4 or 1 in 3 of this young generation because Steve, 80% of those children was obese.
absolutely, absolutely.
So
Yeah,
with them having that stomach fat and they're young, 7, 8 years old, they're just walking into diabetes. They're
Yes.
walking into hypertension. And because the healthcare where they're at may not be good, or the parents are not educating them, or they don't think that anything is wrong, they're going to be the next to have a seat.
Well, and that's what these dialysis companies, they not stupid. That's what they see. And they go off a business
But
model of
something,
using the zip code um, for their business model where they're going to put a dialysis clinic. And that's why you see them in strip malls, in places that you would
mhm,
normally never see them. They're
yeah,
popping up like they belong in the community.
right, right. And there's no town meeting. There's no one questioning like, what is this building? Why is this building being built? The building's built, and there's a couple jobs that goes in there, and that's it. But they don't realize how is it impacting the community. They don't educate. They're not raising awareness. They're not going out into the community or going out to the schools to say, hey, we're going to build a community forum to teach your children how to eat better, how to harvest their own food, so they don't have to go to the local corner stores for this, that, and the other. All they're doing is just allowing more patients. I'm sorry, I'm just getting like really frustrated right now
And no,
because
Tamika,
they're not helping.
Tamika, you're absolutely entitled to get frustrated. I mean, just like myself, we both do this job. We see it from the inside, and just like yourself, I'm getting tired of it because no one is sounding the alarm. That's why, far as I can speak for myself, and I know you are too, but that's why we're so passionate about it, because no one is sounding the alarm, even though that there are conglomerate companies out there who do kidney awareness and research and advocacy, but they don't do it to the point of where it's really, as I call, boots on the ground and getting into that urban community and
Well, for
really
one
put
thing,
for a big push.
their approach on it is wrong because you're directing to people that are already on the machines. Now
Absolutely.
you can educate there, but they're already on the machine. So your education should be mental wellness. It should be, it should be mental wellness. It should be how to live well. It should be transplant information, and it should be how to move forward with this disease.
Absolutely. And
Where
just
they
let
need to go ahead. I'm
no,
sorry.
go ahead.
Where they need to tackle is our babies, our younger generation, our 15, our 16-year-olds, our 20-year-olds, our 8-year-olds, our 3-year-olds.
No,
They're next.
I agree. It's just a wait. We're just waiting. But look, these are the statistics that are going to lead these youngsters to those machines. You have diabetes, a leading cause of kidney failure. Then you have, for diabetes, African Americans are twice as likely to be diagnosed with diabetes as whites. Then you have approximately 4.9 million African Americans over 20 years of age are living with either diagnosed or undiagnosed diabetes. Then you have 12.6% of all African Americans over 20 years of age have diagnosed diabetes, compared to 7.1% of whites. So that alone, that diabetes and the people who are not being diagnosed, that's a walking, ticking time bomb. It's just waiting to happen, where the diabetes, and if you do have diabetes, you're not taking it serious, especially type 2, you definitely need to take that serious, because it's slowly killing the kidneys. And it's not going to happen overnight. It's going to happen over a period of time, where one day you're going to look up and you're going to be in the hospital or going to be in the emergency room because your sugar was high.
But you know what, Steve? I know you say it can't happen overnight, right? But these dances, this Kiki dance and the Shiggy or whatever it's called, this crap happens overnight. It's some dance where people get out the car and they're like, Kiki, do you love me? And they do all this, my son showed me that. So these dance phases or crazes can get popular overnight. Why can't education? Mhm. I'm sorry, guys. I guess some technical difficulties with Steve, but he'll be right back in. So thank y'all for joining us. This is live, so when it's live, things do happen. We just got to keep the show moving. But education is the key. But I don't know why the government or people are not sounding the alarm on this disease. Like I said, we went to Baltimore and you had to see these babies, these children that I had take the pledge. I'm looking at them and I'm looking at their teeth and their health and stuff like that. And I'm like, this right here is going to be a major, major problem. And the doctors really don't care. Welcome back.
Hey, I'm back. I don't know what happened there. My phone, I got two phones, one to the side, and I don't see myself popping up on the other one yet.
So you're up there. You're up there. So we have two viewers that stated something which I think is very important. Tamika Smallwood, which was our guest before, she said education is definitely the key. She had a young man ask her if kidney disease if kidney disease comes from drinking too much alcohol. He has high blood pressure and never knew he was at risk until I told him why. They have no clue. These people here have no clue.
And not only that, with the alcohol, if depending on how much he drank, that could put him at risk for liver disease.
Yes. Yep. And depends on what alcohol too. The strongest alcohol causes the cirrhosis of the liver.
Mm-hmm. Mm-hmm.
And then the beer and stuff is yeast. And what is yeast? Yeast turns into what? Sugar. Like it's, oh my
Yeah.
goodness.
I mean, but how do we begin to change that mindset when a population is so used to one thing for so many years? How do you change that mindset?
Staying consistent with our message and model. Constantly educating anywhere we can go.
Absolutely, I agree with that. Um, it's very important, very, because they're not stopping making clinics.
No, it's more being made. Like they're not going to stop. It's money. You figure each treatment is $1,300 per person, if not more. And it's just not hemodialysis. You got people that's on PD, and PD is like the hidden dialysis.
Yep, yep.
So we're not even touching people on PD. We're just talking about hemodialysis, but they're all in one group. But PD is the hidden dialysis.
Yeah,
That's something that's not talked about. People talk about home hemo and stuff like that, but they don't talk about peritoneal dialysis.
I
That's
agree.
the hidden dialysis that you do at home where no one sees you. No one knows that you have access because you have a port coming out of your stomach. So your arms and legs are free.
Yeah, and I met a gentleman last week at this restaurant that was on PD. He just happened to see my shirt that I have with
Hmm.
kidney disease, and he said something to me about it. And he didn't even look like he was on dialysis. Not that you have to look a certain way, but as we was talking, and I mean, his skin was I mean, he didn't look like he was on dialysis. How you could tell with some people with the skin or is pretty dark, or they have the the access with the aneurysms. But this guy, he looked completely is no thing for normal, but I just wouldn't have known if he didn't say anything.
Right. You know, oh my goodness. It's just so sad that we're in a generation of so much technology, but not enough technology to keep the word going. You know, that's Tamika Smallwood just said something. Okay. She said, it's hard to change when you don't know. Yep. She said, that's why she used her page as a platform. People tell me all the time they never knew anything. And sorry, they never knew anything until she started sharing about kidney disease and dialysis. Yes, Tamika, if more patients will actually come out and start sharing about being on dialysis, how dialysis affect them and how they got there, you'll be surprised how many people would turn their life around. And if you say a message to them, to those with healthy kidneys, if you had a second chance, what would you do before you got on dialysis? How would you have changed your life? Someone out there is listening. There's always someone listening and watching.
Oh yeah, and then
we know that.
right. Hey Tamika, now listen to this. If you're watching out here and you know someone with high blood pressure, now these are some startling facts about high blood pressure that people don't know. That blacks and people of African descent in the United Kingdom have among the highest rates of hypertension of any race or ethnic type in the world. 35% of African Americans have hypertension, which accounts for 20% of African American deaths in the United States, twice
Wow.
the percentage of deaths among whites from hypertension. I mean, African Americans with high blood pressure have an 80% higher chance of dying from a stroke than in the general population. 80% if you got high blood pressure of dying from a stroke.
Wow. Wow. So tell me this, Steve. Is there medical out there free?
Um, they do have free health clinics, but I think they operate on a sliding scale. But there are some free health clinics. I even thought about at one time the prospect of trying to do one because it is needed, but it takes a lot of logistics to put together a free health clinic. But yeah,
Saying was
there are some free health clinics out there in the United States.
no. So what I was saying was I've been doing a lot of research on the countries that have free healthcare.
Oh, free health. Okay.
Healthcare and Australia waits to the last minute for people to receive kidney dialysis, which a lot of people wind up dying.
Wow.
Mhm.
So
They
they
wind up
actually
dying.
to your GFR, your numbers get lower than five. I mean 15%.
10.
Okay, so you got to actually be having some symptoms, and they have to
Yep.
be kind of severe in order for
Yep.
them to initiate the treatment.
Yes. Yep. And if they're in pain, they give them pain pills as if that's going to really help them. I mean, it's quote unquote pain management, paying for their treatments. So they're going to wait to the last minute to help them.
Right. Now, Tamika, doing your research, did they list what was the main cause over in United Kingdom? I mean, over Australia for kidney disease?
Yes. So we call it diabetes type 2, and they call it urban diabetes. Yes. So
Re-
over there in Australia, it's called urban diabetes.
Urban diabetes.
Urban diabetes, yes.
Interesting.
Very interesting. That's what made me start doing a little bit more research.
Now,
So right now I'm working on Canada because Canada have free healthcare. So I'm seeing what their stats is with kidney disease patients
Wow.
and diabetes and hypertension and stuff like that. Because if these countries that have free healthcare are literally waiting for people to, well, be in the last stage, that says a lot too.
Oh, absolutely.
You
Absolutely.
know,
And I wonder what's their transplant rate.
ratio.
Yes.
I'm not sure. I didn't get that far in it. I just wanted to see, like, how long does it take for a person to get on dialysis there?
Right. So, Tamika, let me just share the risk factors for diabetes if anyone is watching uh, that may want to know what causes diabetes. Not what causes, but what may put you at risk.
Okay, go ahead.
So, 45 years or older, overweight, African American, Asian American, or Pacific Islander, American Indian, have a parent, brother, or sister with diabetes, high blood pressure, high cholesterol, and physically active less than 3 times per week. This all puts you at risk for diabetes type 2. And there's a lot of people out there with diabetes type 2. And I put
Mhm.
together uh, top 10 suggestions
And
of what you can
mhm.
do to protect your kidneys. Uh, One is control your blood sugar and your blood pressure. Two, know your numbers, you meaning your kidney numbers, GFR, glomerular filtration rate. Three, visit your healthcare provider. Four, be physically active. Start with a moderate level of activity, such as 30 minutes of walking. It could be brisk walking, bicycling, possibly dancing, or gardening, or some light exercise. Five, maintain a healthy weight. You want to choose foods lower in fat and calories. Eat more fresh fruits and vegetables. And also, when you cook foods, do so by broiling, grilling, or boiling instead of frying. This decreases the sodium intake. Six, if you smoke, stop smoking. Smoking makes the heart work harder. Seven, get tested for kidney disease. Eight, make healthy food choices. Nine, drink at least 8 glasses of water per day. And 10, if you take medications for BP or diabetes, make sure you take them when due. Those are 10 suggestions that I came up with or research that I think will help people protect their kidneys.
I agree. I really agree. Also, more what they call plant based. Stay away from that meat. That meat is
Oh,
toxic.
yeah.
That meat is really toxic. That's good. We need to put that down and put it up all over the different pages that we're on so people can really read that.
I saw a question from a Latia Holmes that said, "Does routine blood work alert you of kidney issues?"
You want me to answer? Or you going to answer?
Oh, you can.
Okay, so not all the times the doctor will check your kidneys. That's if you have like hypertension, diabetes in your family, they may check it. You may have to ask them to check it. When you go to the emergency room, like if you go to the University of Penn, this is one of my girlfriends, she lives in Philadelphia. If you go to University of Penn will give you a whole sheet of what your labs are and what your lab's supposed to be. So your GFR is on there. And so your creatinine level and your BUN is on there.
And see, that's another thing, Tamika, with that has to be discussed as well. When patients get their lab work back and the doctor just hands it to them and doesn't go over it, and patients just take the lab work home and don't know how to interpret the results.
Right. They don't go over it with you, but they do have like the high, the low, and stuff like that. And it's up to you to highlight it and go to your primary care doctor and discuss these lab findings.
What do we do about people who don't know how to read? Because there's many patients out there, or people out there as well that they can't read or understand. And I met a lot doing dialysis that really didn't even understand the process.
Well, if a person can't read, there should be an honest person in their family to help them. A lot of times you have family members that's doing that want it for money, that's generally not doing it out the love and care for their loved ones. But generally, someone should be with that person that's unable to read and that can help them with their medical issues.
I agree. I agree. It's
People that's
just a
not.
disease
Yeah.
all the way around.
Yeah. Yep. You're so welcome.
Absolutely. Thanks for watching, Latia. Thanks for watching.
Yes. Thank you for watching. Yep. So let's talk about a person that's on dialysis or that's getting on dialysis, the question they should ask, because we always have these different conversations with people and they say, well, my doctor didn't tell me, my doctor didn't tell me. Well, it's time for you to be your own advocate. You have to ask questions. Just like
Absolutely.
people go and people ask questions when they go in a sneaker store, they say, well, do you have these sneakers? Whatever colors do you have? If you don't have my size, do you have another size? So we ask questions about things that's not that important versus asking questions about things that are important, like your health.
Absolutely, I agree. And that even goes down to um, knowing what your dialysis prescription is and what
Yes,
your machine settings should be set on,
yes,
because even though we are health professionals, there does happen human error does happen.
yeah,
That's what I want to
it
say.
does. Yes.
And
And it
and
happens a lot when
especially
we're rushing.
oh, absolutely, especially now with the kind of the environment that these companies create, almost like a factory type environment, and rushing, that you may, or the person who is caring for you may forget to put that 1K bath or that
Hmm.
3 calcium bath, or turn your pump up to 450 where it's supposed to be, or give you your heparin when they
Hmm.
supposed to be giving it to you. So much stuff that is detailed um, in this process that you almost have to be your own health advocate, or if you're not, then you're just leaving it in the hands of the healthcare worker, letting them, or just trusting that they're going to do what they
But it's
supposed.
right. Right. Now, as a dialysis technician, Steve, everything that you have said, I have done numerous times, more than numerous times. I've been doing this for 19 years, and I have done it so many times. I've done it up to last week when I forgot to give a patient heparin. So these human errors does happen. I try not to do the baths often. I try to, make sure make sure the prescription is right. But sometimes things do happen. If there's a cold or, someone falls and you try to help them, then you come back and forget where you left off at. Then these type of things do happen. So let me say, I have done it, many a times. So there's 10 questions to ask your doctor about about kidney failure. Which first it was renal failure, now it's kidney failure. They're just trying to change the name so it doesn't sound so scary. So you'll hear different names, but they all mean the same thing. If you hear renal disease, it's kidney disease. All right. So you want to ask what caused your kidney failure. A lot of times people don't even ask, they just hear, oh, I got to go on dialysis. And when you ask them for what? Well, my doctor didn't tell me. Well, it's up to you to ask them.
I agree.
You're just a number. So ask them, well, sir, Mr. Brown, whatever, what actually caused my kidney failure? Could I have prevented it? Then the next one is, do I have hypertension or diabetes? Could that worsen my kidney condition? Another one is, what type of dialysis do you recommend? Someone doesn't have to just take hemo. They can take PD. PD, they do it at home with a little port in their stomach. So there's different ways to do that. Sorry, different ways to do dialysis. A great one and early on to ask is, am I a good candidate for a kidney transplant?
Great one.
That's a great one. Also, what dietary changes do I need to make during my treatment? That's one that's usually forgotten. They usually find that out later on once they actually hit the machine versus before they hit the machine.
And
Um,
see, there's a whole, just to interrupt you for a second, there's a whole complete diet, a pre-renal diet that person is supposed to be on right before they, hit dialysis to try to, save your kidneys. It's supposed to be a low protein, diet,
mhm.
opposed to when you get on dialysis, then they want you to have more protein.
Right. Also, do I need to make any other lifestyle changes? I've never heard anyone even ask this question. And I, what they call ear hustle all the time when they're doing the care plans or the assessments, just to see what's really asked. Also, do I have anemia or any other complications? Like, do I have any other health issues that will affect my dialysis? No one even asked that. What do my labs look like? No one even asked that. How can how can those complications be treated? So if they have any labs that's like, I guess, out of whack or anemia or anything, how can it be treated while they're on dialysis? Does something change? So these are questions no one ever really asks their doctor that needs to be asked, because this can help your care be better than what it is.
Oh, absolutely, absolutely. Knowledge is power.
Hmm. I think people ask more questions, the power of asking. This show exists because of the power of asking. I get so many no's trying to get guests, but I still keep asking. And it's so important that you talk to your doctor like you talk to your girlfriend and ask questions and want to know why. Because if he sees that you care, he's going to care too.
Absolutely, absolutely.
Yep. So it is winding down to the end of our show. Does anyone have any questions? Let's
You,
see.
you know, Tamika, there was something else I wanted to share with you, that people need to be aware about, and they probably already know about kidney disease.
Mhm.
Is that this is the one thing that's really important that people have to know, and I think this is really important to emphasize that if you can get people to get tested, because 9 out of 10 African Americans have stage 3 moderately reduced kidney function and don't even know it. And if there's some way where people could get
More
persuade,
testing.
yeah, get tested to know where they at, if it was a big push for that, I think you could save or prevent a lot of progression of kidney disease, especially with 9 out of 10. That's a lot. Stage 3 that means you're almost at stage. You got 2 more stages to get to
The
5.
five. Right, but see, that comes with the healthcare industry. They have to push for that because they really start checking your kidney function at about 45, 50. They don't care to check it when early long if you don't have a family history of kidney disease, hypertension, diabetes, and that's why they have you answer those questions so they know what they have to look for. So if you're checking no, 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 they're just going to look for the basic tests. They're not going to look for anything else.
That's right.
It's just like taking your car to the mechanic and you're telling him, "Oh, I think my transmission is going." Well, you know what he's going to look at? Your transmission.
Mm-hmm. Mm-hmm.
Is there your stage? Okay, so Latita, she says, is there a stage you can be at where you seek the correct care and actually get rid of it completely?
Now,
Steve?
once you get kidney disease, it doesn't go away.
Mhm.
So kidney disease has 5 stages. If you're in stage 1, you don't have to progress to stage 2. If you're in stage 2, you don't have to progress to stage 3. If you're in stage 3, you don't have to progress to stage 4. But once you get to 3 and you continue to do what you're doing that got you to 3 and you get to 4, you're really, it's just a pretty much a waiting period unless you really being conservative and managing, the disease. And that's why that we try to get that information out there. So if you know what stage you're in, you can manage it. But once you get kidney disease, it generally doesn't go away, and it kills your kidneys over a period of time.
Mhm.
But it doesn't have to happen that way if you get tested, and once you know where you're at, you do the preventable things to prevent you from progressing the disease. Because I mean, you can prevent the progression or slow it down.
Mhm. Of the disease. But it's also, once again, Steve, of going to the doctor frequently. You know, some people go to the doctor every 5 years. So if you go to the doctors every 5 years and you have this problem, well, you had this problem for 5 years without treatment. So there's no turning back now. You know, so it's just so important to constantly, for one, find a doctor that cares, find a primary care that actually cares, that he's just not for health care, he's for your care, that he's just not trying to give you continuous care, he's trying to help you have better care. Because a lot of these doctors have what they call continuous care. They'll give you one medicine, they'll wind up putting you on another medicine and never addressing the first issue at hand. So just
Basically, but I'm just saying, basically, what you're saying is they're treating the symptom and not the actual problem.
yes. Yep.
Yep,
That's what a lot of them do, because if they treat the problem, who has a job?
that's true. And with diabetes, instead of getting people metformin and all these other oral um, diabetes medication, if you change your lifestyle, you know, your dietary and increase your exercise and lose weight, then you can pretty much reverse that process.
Mm-hmm. Yep. But it's all in being educated and being your own advocate. So if you want something done for your health care, you have to speak up for it. If you want your doctor to check your GFR rate, tell him you need your GFR rate. Ask, can he check your kidney function? If he says no, go to another doctor. Your insurance is going to pay for it. They do stupid tests on you all the time that's not even required, but they do it on a research level, and your insurance pays for it.
Yeah, yeah. This is serious, guys. This is really serious. And I mean, if people don't get this checked out, next thing you know, you may be ending up going to the dialysis clinic right down the street from you, and
Yep,
the how you got there.
yep. People don't even think about how they got there, or it's becoming so common. that as long as they're able to survive, they don't care. Because when I talk to my new patients that come in, and I'm like, well, how do you feel? Oh, I'm fine. It's just the way of life. No, it's just not a way of life. Like, you don't have to be here. Like, there was something that happened that could have stopped you from coming here. You need to find it, because there's someone else in your family about to go through the same ride that you went on, and you can prevent them from coming here. This don't have to be a way of life. Don't get comfortable.
I know, I know. I mean, that, as we was talking earlier, and what I was mentioning to you, that this disease is so dynamic. And when you were saying that, when you just was mentioning um, about the family, I've seen generations of family on dialysis, like the
Yes.
mother, grandmother, and the granddaughter.
Yes. And Steve, like, I could see if we was talking about like polycystic diseases like that, that's genetically, renal failure or whatever. But we're not. We're talking about things that can be prevented. You don't have to have diabetes. You don't have to have hypertension. You don't have to have these things. So
Absolutely,
it's all in
absolutely.
personal choice and education. These things could be preventive. These are preventive diseases. We can't prevent PKD, polycystic kidney disease. We cannot prevent it. We can't
Right.
prevent sickle cell. We can't prevent lupus. We can't prevent those things. But
That's right.
diabetes and hypertension, you don't have to have it. Well, type 2 diabetes, you don't have to have it. You just
Right.
don't.
And those are two leading causes
The
of kidney
kidney
failure.
disease. Yes, especially with African Americans, minorities, people of South Pacific islands, like
American Indian.
American Indians. Yes, there's some type of trigger. There's something in our net that causes this. They really need to do better research on it. There's something bigger than this, and it's why that we are getting it.
Absolutely. And I think it comes
As
down
with
really to
disease than
diet.
any other. Hmm?
My opinion is it comes down to diet, because they saturate our communities with these stores, the zoning. Because if you go in certain neighborhoods, like community neighborhoods in Baltimore, you don't see a convenience store on, 4 or 5 convenience stores in one block or anything like that. You see nice shopping centers and supermarkets. So to me, I really think how they flood the urban community with all these gas stations, the convenience stores, the fast food restaurants, um, and the lack of access to affordable health care and fresh fruits and vegetables. I think all that combination, and it could probably be some more stuff as well, but I think that all that is a big contributor, um, to this
So it,
diabetes and hypertension.
okay, so let's say, because I'm looking at India, right? In India, 31% of their kidney failure is from is from diabetes. 12% of it is from hypertension.
Well, we have to look at the Indian diet, because they
Yes.
eat, meat, and
Mhm.
you know,
Yep.
some of their
So
food
it's
is
just
high in
not
salt as well.
right. So it's diet, but Steve, I believe it's something else. Like, and that's just me personally, like looking at Asia, looking at India, looking at Africa, looking at Trinidad, looking at all these different places. And I'm like, okay, well, in Trinidad, they have some of the freshest food and they have a high rate, which they are in need of more kidney care centers and more dialysis technicians. So if these places have these amazing foods and not a whole lot of processed meat and stuff like that? Could it be genetics? Could it be something that minorities have that white people don't have, of why we're here? I'm just saying, like,
No,
I'm
I
just
know.
throwing a theory out there. So it just makes you think deeper past the foods, like the foods most definitely. But is there something that we have in our DNA?
Right, right, got you.
You know
That
how, like,
predispose us to that.
right, like, when we have hypertension, we need to take a beta blocker. Only African Americans have to take a beta blocker. There's no other race that have to take a beta blocker when you have hypertension. It's just us.
Hmm.
Yes. But a lot of people don't even know about the beta blockers because they're not told about the beta blockers.
Right. Well, yeah, I wouldn't expect. I didn't know about it until I went to nursing school.
Yes. Yes. So I didn't go to nursing school. But
But yeah, I see. I know what you're saying, though. See, that's what I'm saying. Stuff like that, people that are not even thinking about that type of information to ask their doctor, or be involved in, or even think about it, because they probably got so much going on in their life that that's just a second get, a second passing.
yeah, so that was just some food for thought for the evening,
Absolutely.
just to make you think. Because now, since I've learned about the beta blockers from my aunt, she's a nurse, and she was the one explaining to me how the beta blockers work. And I'm like, well, hold up. Well, we're the only, something's not right.
Hmm.
What chromosome or what part, something that they don't say that we have genetically, of why these diseases hit us like they do. So let's see, we have one more question. Kidney disease is across all races. Yes, kidney disease is across all races, but most of the kidney disease from hypertension and diabetes is from minorities. So we're not saying only minorities get kidney disease. We're saying that these two are mainly the minority population across the board, overseas too. So it has no, we're not saying that, oh, it's a black thing, a white thing. No, we're just saying where this illness, these urban community illnesses are at, and is in the urban community. And who majority lives in the urban community? Minorities. So we're not taking away from any other race. We're just stating facts.
Hmm.
That's all we're doing, is stating facts. White people have kidney disease too.
Hmm.
We're
Absolutely.
just stating the statistic facts. These are not our sayings. This is what we're getting, and we work in this field, and we see this every day. So don't think that we're saying, oh, this is a black thing, because it's not.
I agree. I agree.
So, um, I just don't want anyone to think, oh, they're just saying, the minorities or whatever. No, this is all across the world, all across the races and stuff like that, but it predominantly affects African Americans when you're talking about hypertension and diabetes. So
Yes.
that's basically
At a
what
much
we're
higher
saying.
rate.
At a higher rate, yes.
Hmm.
So, but thank you for watching us. Thank you
Yeah.
for joining us. Thank you, Mary Beth, for your comment. Thank you, everyone that commented. Thank you, Latita. She's gonna kill me, but I'll deny everything.
Pat
Thank
and
you,
Pat King.
everyone. Yes, for joining us. Your comments, your opinions, everything matters here, because we are on the same course to raise awareness for kidney disease, to get the education out there, to, as Steve said, sound the alarm. Disease isn't getting any better, it's getting worse. There's more and more people on this kidney disease situation, more and more people with disease, I'm sorry, on the machine, and more clinics are being built every day.
That's right.
So,
That's
yep. So have a great night, and we'll see y'all next
absolutely.
week.
Thanks for watching. Be aware, get tested because a lot
Yes, for the
of ways may be.
welcome to yes, thank you.
All right. Good night, everyone. See you,
Good
Tamika.
night. See, Steve, stay on.